Hello, everybody. Thank you for joining us this afternoon. Today's webinar is on treatment planning and case presentation, hosted by myself, Karina. I've probably met some of you before, and Neil, he'll be going through a demonstration with you. A few housekeeping tips before we get started. The webinar is going to be recorded. You will receive a recording or an email with a link to the recording at the end of the webinar. You are all in listening mode only. Please feel free to use the chat or the Q&A if you have any questions, but we will have time at the end for questions as well. So some key features that we'll be covering today: creating a case presentation letter, ordering our treatment plan phases and visits, writing notes for our phases and visits, creating the letter for the patient, and obviously presenting that case presentation letter to our patient. Some of the benefits for the dental practice: patients better understand their treatment plan, you build trust with your patients. We see a higher acceptance when patients can understand their treatment plans a little bit more clearer. Reduce patients' anxiety and stress by laying out the steps clearly. Easy planning and clear communication. And then overall practice growth. Patients are happy, you'll get more referrals. So I will hand it over to Neil, who will continue with the demonstration of today's presentation. I will be answering questions throughout if you do have any, but I'll stop sharing my screen and hand it over to Neil.
Okay, so first thing I'm going to talk about is the creation of the treatment plan letter. So can you see my screen, my Dental for Windows?
I can see your screen, yes, Neil.
Okay, so to create the case presentation letter template, first of all, we go into Dentists and Marketing. Go into Patient Records. And we come to the Letters tab. On here, you'll see a category that says Case Presentation. You may not have anything there. So what you can do here is go Template and create a template. I've created 2 templates here because you can have different templates for different types of treatment. So I can click on the root canal one and I can go Template and Modify Template. And this is going to launch Microsoft Word with the template. So the template contains what we call input fields. So all of these are captured from the database and are populated when you actually open the letter. To add an input field for Word, we go to Add-ins, Insert D4W, and Input Fields. You can see here we have patient details, practice details, which is these and these. And then further down, we have treatment plan. And that's where we have the treatment plan items, case presentation label, notes, and also phase visit labels notes. And you can see designed here, I've got the labels and the notes and the items performed. So you can actually set this up to be any way that you like. You can format it yourself to be any way you like it to look. When we close, it'll ask you, do you want to save? And we say yes. So the next step is the treatment plan itself. So we go to the treatment plan tab, and I've already created a treatment plan here for a root canal. Now, the way that the case presentation works is it ties in with visits. And that's this column down here. So what we do is we assign item numbers or procedures to a visit. So the way to do that is we go down to here to order visit, and you'll see the screen will change. What we do now is we highlight the items we want in that visit. When we've got them selected, we click visit 1. And then we repeat for visit 2. And then the same for visit 3. And any other visits beyond that. You can also set a time for that visit. So we can say that this first visit is a 30-minute visit. We can then tell it that the second visit is 60 minutes. And the third visit is 45 minutes. Now you can say 20, 20, 20 or 60 in 1. It's easier to do that. And I'll explain the benefit of that shortly. As we did that, you'll notice on the right-hand side, we have phases and visits appear in the case presentation. If you don't see this screen, we go to Find View a Treatment Plan and Show Case Presentation. And that will show this page. So the next one is that we put labels and notes on each visit. And this will appear when we do the case presentation. So to do that, we double click. So I'm going to double click on title. And here I'm going to add in a label. When I do that, you will now see it has title. And we can do the same for each of these. Then when we come to visit, we can actually put in more details of what's actually involved in that visit. So you can see here, I put find canals and dress to rid toothache and drain abscess. And in the note, I'm just going to put in a note saying that it's a 30-minute appointment. And just repeat the process for each visit. And all of this is purely to make the case presentation letter easier to read for the patient. So now that we've done that, the next step is to actually create the case presentation letter. To do that, we go to the Treatment Plan drop-down menu. Then we come down to Create Case Presentation Letter. And you can see there are the 2 letters that we had in the templates. I'm going to select the second one and OK. Now, again, this is going to launch Word. And now you'll see everything has now populated within that letter. So you can see below an outline of your required treatment. And so you can see I've got visit 1, find canals and rest to rid toothache and drain abscess. Visit 2, complete cleaning of canals. And visit 3, filling up of canals. So you've got a detailed description here of what each visit entails. As we scroll down, it's showing a summary of the items performed on each visit and also a subtotal of each visit in terms of cost. And at the bottom, we have a final visit or final cost for the entire procedure. So what you can do now, we can now print that and give it to the patient. Or if your system's set up, you can email it as well. Once we've finished, we can just close the document and it will ask, the current document is not saved. Save, we'll say yes there. So the next question is, how do we find that letter now we've saved it? So we go to the treatment plan drop-down menu and we come down to open existing case presentation letter. And there's the one we just did. We can now open that. And again, that opens Word and opens the letter so that we can make any changes if need be. Now in the letter, you can insert images, things like that. You can either go insert and insert a picture, or if we go to add-ins, we can insert from charting. So you can actually insert a copy of the chart if you wish. Now, I mentioned before the advantage of assigning visits and also assigning the time. When you create an appointment, you can link the appointment with this treatment plan. You can actually make the appointments now a week apart if you like. So we go to appointment book. We create an appointment. When we do that, you'll see it's found the treatment plan. And visit 1, visit 2, and visit 3. If I select visit 1, because I've told it 30 minutes, that is automatically going to change the duration to 30 minutes. What it will also do is it will specify here items performed within that appointment. The advantage of that is that if you run a production report, so plan production for the day, that will tell you what procedures you're performing today. So if we go to reports and plan production, and I tell it today for room 1, you'll see it's showing me what fees I'm doing today. This is only populated if the appointment is linked to the treatment plan. So it helps you to determine how much production you're going to do in dollar value. Okay. And that's a rundown of creating the case presentation letter and linking it with the treatment plan. Would anyone have any questions at all?
We've got a bit of a quiet crowd today, I think. Is anybody able to use the webinar chat? I just want to make sure that you're able to actually ask a question, or you can use the Q&A if you have one. Can we insert a 3D chart?
Yes.
Yes, you can. Yeah, you can. So the same method as Neil was showing. If you use the input field, you'll have the option to insert your 2D chart or your 3D charting.
I'm going to open an existing.
The chat is disabled. Okay. I do apologize about the chat being disabled, guys. Please use the Q&A if you have a question.
So first of all, if I go into add-ins, insert D4W, I can insert 3D chart. I can insert 3D current condition or treatment required chart as well as 2D. With the patient photo, did you mean into the case presentation or into the patient record? Because to import it into the case presentation letter, we just go insert and picture and select the picture.
Yeah.
Into the case presentation, sorry. However, you can import a photo into the patient's record, which is where we go to the Patients tab. We go to the Patient drop-down and we import picture. And that will allow you to import the patient's picture onto the page here. And you can toggle between custom fields or the photo. And that's how you would do that.
Someone has also asked, can we insert an X-ray or OPG? Yes, you can.
It all depends if you have Media Suite. I'm trying to think if we can do it from here. So what you would need to do is you would need to export the image as a JPEG, for example, and import it as a picture. This one we can't import from Media Suite.
I'm just reading the questions as they're coming through, guys.
Okay, so with the treatment plan connecting to an appointment, if it doesn't see the treatment plan, it's possible that the treatment plan is either marked as inactive, so active treatment plan is unticked, or when you make the appointment, it will show the latest treatment plan. But you can select here to view other previous treatment plans. So if you're inserting a photo, and that can be could be any photo on your hard disk. If you're putting it in the patient's record, typically gets a photo that's been taken, they may supply it to you, or you can take the photo, either way.
Okay.
Okay. So with the photo, So we're going to go back to the patient's record. I'm just going to select a photo. I'm just going to select any image. You'll see now that I've added this image here. So if you upload a patient's photo, this is where it will appear. And you can copy it or you can toggle between input field or custom fields and the photo. Okay, so with the treatment plan, you can modify the plan's date, or you can modify the author of the plan, which is sometimes different to the patient's main provider. To do that, we go to the treatment plan drop-down menu and we come down to modify date, time, provider. And here is where you can change the date, the time, or the provider. And this is the provider who actually created the treatment plan. By default, when you create a treatment plan, this is the same as the patient's main provider. So you may need to change it here if it's a different provider to that. Okay. So we can't copy and paste from Media Suite. And with this template, we can't do it. But some templates in the letters area, we can import from Media Suite, but not in this area.
So somebody has asked, Neil, where does the picture get inserted on the page? So it's just like using a Word document as you would normally. Where your cursor is
Yes.
is
So if
where
you want
the
to
picture
insert a
will
picture
insert.
here, you would then insert picture. And will get inserted where you have your cursor, as Karina said.
And you can change the picture as well. You can move the picture around once you've inserted it.
Yes.
Also. So yeah.
And also with Word, as normal Word, you can make it an inline picture, which means it appears as part of the text, or you can actually put it over or behind text. Most do inline, which means it acts as a line of text in the document.
And somebody has also asked, can we show for an orthodontic treatment plan? So the case presentation letter you would set up as per orthodontic treatment, and then the item numbers you would be using would be your orthodontic item numbers. So the whole process is
the same.
You're just going to cater it to the treatment that you're doing. So when we set up the example of a root canal treatment plan or case presentation letter, I should say, this is just one example of many that you would set up in your practice. So you may have one for root canal and a crown. You may have one for just a crown, or like you've asked, orthodontic work or procedures.
And the main reason you would do different templates for each different type of procedure is that you might have different text in it relating to that procedure. So you might have post-care, for example. So if I go into the root canal one, sorry, I'm just waiting for this to load. So you can actually put in, like we've got here, when is root canal treatment required? So in an orthodontic one, you would have this part would be the same, but you would have information here relating to orthodontic or to crown or whatever the case. That's the main reason you'd use different ones for different templates, different procedures. So Kira, if you can provide with your site reference number, and then we can have a look and see what's happening there, as to why you're not getting anything on the letter. It could be the visits, it could be the labels, it could be the notes, it could be anything like that. We would need to determine, or speak to our support department and they can help you out. So yes, you can change this template. So if you have the template set up and you want to just change one word for that patient, you can certainly change it.
So you can modify the letter individually for the patient that you're creating the letter for, or you
Yes.
can go back to the letter template and change the entire template so it comes up
That's correct.
with whatever
So
your changes you want to make.
if you change it here, it'll change it for every time you do this letter. However, if you change it when you open the case presentation letter and make changes, it'll change it for that one only. But yes, you can change it there.
Does the template show up in every patient's records?
Yes.
There will be a template there for you to choose for the case presentation letter. It will be in each patient's records, yes.
Yes. So when you go into the treatment plan, and when you go into create case presentation letter, all the templates will be there. And yes, if you want a letter designed for different providers, you would then have separate templates here for each provider. So Doctor 1 RCT treatment plan, Doctor 2 RCD treatment plan, etc. And that way you can put a logo or anything on for that particular provider.
Can we set up can we set it up so that the pictures get automatically inserted in I'm assuming you mean in a certain position each time? The pictures you would insert at the time of creating the letter for the patient. You can put pictures into the template, but that picture will show up for every single patient because that's your template. So if you want to insert the patient's x-ray or the patient's photos, you would need to do it at the time of creating that letter for that patient for their treatment.
Yeah. The only way to have that automatically happen is to insert a picture into the template, which means that same picture is open every time you open the letter. And the same procedure applies with Dental Web. There is no difference in the way that you actually do the case presentation of the treatment plan.
couple more questions coming in.
Yes, there is templates on our eSupport with examples of how to build the treatment plan or the case presentation letter. And you can access eSupport by going to your help menu and coming down to eSupport. And this is covered under your support and maintenance contract. So it'll take you into eSupport. So with a template, if it's been used, you can't delete the template. However, what you can do, if it is no longer applies, we can go to template and we can mark as inactive. The mark template as inactive/active, that's a toggle. So if I do that, they will mark it as inactive, which means it won't be visible. It hides it.
Okay. Thanks, Neil.
No problem.
I'm going to conclude today's webinar. Okay, so as Neil has just shown you, eSupport is going to have all of your, the articles on everything that we've covered in today's webinar, and there is templates that you can use and make them your own. You can also email us or visit our website and our Dental for Windows Facebook group. The link for that group is there, so you can follow that link and join. We do post tips and tricks and all sorts of information on our Facebook group. Do we have any further questions at all?
I did see a raised hand. If you'd like to type your question into the Q&A.
It's not coming through, I don't think.
Okay. Yes, you can delete a treatment plan. I'm just going to share my screen. So here we can go to treatment plan and you can come to delete whole plan. And this will allow you to delete that whole treatment plan. So the one that I've shown you here is for a root canal. So it'll be the same concept. If there's more visits, you might have visit 4, visit 5. In a more complex one, so say you might do a root canal followed by a crown, you would then assign a phase. So you would say the root canal is phase 1, phase 2 is the crown, all as part of one treatment plan. Okay, so if you have multiple templates, if you have multiple procedures, so as I mentioned, we go to treatment plan, create case presentation letter, and here is where you'd have your different treatment plan case presentation letters for each procedure. So you might have one for ortho, you might have one for crown, you might have one for extraction, and have different letters for each different procedure. And that's where you would choose the different letter. So I'm not sure what you're referring to as far as treatment plan template. It could be that you're referring to operations. So you can access those in either charting or the treatment plan page. But you can see on the treatment plan page, we have operations. And here we can say root canal, and this is where you can choose your root canals. And what this will do, this will insert the item numbers relating to that procedure. And the same from charting. When you chart a procedure here, from these or your operations drop-down menu, that will add those items into the treatment plan. Now, depending on how your system is set up, but yes, you can email as a PDF from case presentation. Okay.
Okay.
Does anyone have any more questions before we finish up? Okay, so to set up those letters, in the patient record, we come over here to letters, and we go to the case presentation group. And here, if there's none here, we can go insert or template and create template. And that will allow you to create a new template. And on eSupport, you will see information that helps you to build a case presentation letter. You're welcome.
Okay. So that concludes today's webinar, everybody. Thank you all for attending. Hope you enjoyed and learnt something new and hopefully can implement some new practices at your surgery. You will receive a recording of today's webinar, and also it'll have the links for the eSupport links to where you can get all the information and the template examples that you can use.
Thank you.
Thanks, guys. Bye.